Hi, I'm Audra Burns, and welcome to Heads Up, a year-long mental health awareness journey, Dartmouth Health's webinar series, which focuses on the important mental health topics that affect all of us. Today, we will discuss the current state of mental health care and what areas of public policy at the federal and the state levels still need to do to address to make much needed progress. So I have three great panelists joining me today. So please welcome Dr. Will Torrey, psychiatrist and chair of the psychiatry department at Dartmouth Health. Hi, Dr. Torrey.
Hi, thanks very much for having me.
Glad to have you here. And joining us is Holly Stevens, the Director of Public Policy at the National Alliance of Mental Illness, otherwise known as NAMI New Hampshire. Hi, Holly.
Hi, thanks for having me as well.
Great to have you here. And rounding out our panel is Matthew Hood, Vice President of Government Relations for Dartmouth Health. Hi, Matthew.
Hi, Audra. Nice to see you.
Great to have you here. So now the goal of this year-long series is to really help change the conversation around mental health and to truly end the stigma associated with it. Now, while much of the work is done at the levels of society to reshape our culture and awareness and perceptions, we know that certain changes also need to happen at our state and federal regulations in order to reflect the stigma-free world that we truly want to live in. So now we're going to have an opportunity to provide equitable care for people who suffer with mental illness and support their family and friends, employers, and loved ones. That's truly what we're trying to get at. So Dr. Torrey, let me start with you. So you followed the evolution of the country's mental health infrastructure and capacity, especially here in New Hampshire. So what major milestones have we achieved in recent decades that have really brought us to where we are now?
Thanks, Audra. So I'm going to really start with the good news, and there's a lot of it, really. And I think as a society, there's just a much greater understanding of how common psychiatric difficulties are. You know, these really are not illnesses that happen to other people. They touch all of our lives. But if we ourselves haven't lived with one of these illnesses, we're highly likely to have a loved one who has. And so this understanding actually is driving many, many more people to advocate for high quality services, which is really what we need behind all the changes that we're trying to make. So over the years, in addition, we've just learned a tremendous amount about how to support the recovery of people with psychiatric difficulties. We have much more effective therapies, medications, and support for housing and work. And we have treatments that work really well. And in addition, there are dedicated people across the country, and definitely here in New Hampshire, who are working really hard to provide outstanding services. So, for example, our department has partnered with the state of New Hampshire to provide high quality services for people that are in desperate need of these services. We provide all the psychiatrists and psychologists and nurse practitioners at the state's only state hospital, which we think of as our intensive care unit. And we also support people with autism and developmental disabilities, young people. And this partnership really means that people have access to extremely high quality care. Another important development just recently is that the community mental health centers have been building out mobile support for crisis intervention. And this means that people who are in crisis can get help at home or locally. And this is frequently avoiding the need to go to the emergency room, which is just a much better way to get care for people. So I think that development is also really very, very good news. Our department is actually helping the state to evaluate that so we can make sure we're doing it as well as we can and look for ways to even improve that service. But I think that is good news.
Yes, certainly lots of good news. And I know there's still much more to come. So that brings us kind of to the present. So as a practicing provider, what are you seeing are the biggest roadblocks to patient care with mental health care today?
Well, I think everyone will agree that the biggest difficulty is timely access to high quality care. The demand for services, the need for services just far outstrips the state's capacity to offer those needed services. You know, if you develop cancer, heart disease, orthopedic injury, you can get into outpatient or inpatient treatment in a timely manner, but it's just not true for psychiatric illnesses at this time. We don't have a smooth system that functions as a system so that people can get the outpatient care when they need it to avoid inpatient care. And it's really due to longstanding funding problems, and both in the private and public sector, and as well as the need to invest in workforce so that the people who can provide the care in a skilled fashion are there when we need them.
Well, I know you and your team are certainly working hard at that. So we appreciate all the efforts around mental health that you're doing. So Holly, let me turn to you now. What are areas of New Hampshire public policy that you're focusing your efforts on? And, if you can kind of give us the 30,000-foot view of how you see public policy landscape shifting, especially following the COVID pandemic.
Well, I mean, for the overall, the 30,000-foot view, as you mentioned, is we've seen a shift in policy, and that there's more bills coming through the legislature that do have to do with mental health right now than in previous years. And a lot of that is a reaction to the fact that we are in a mental health crisis, both for the adult population and really more so for the youth population. And a lot of that has to do with COVID and the effects of COVID in general. And so some of the areas that we've been working on, like as Dr. Torrey mentioned, the 988 system. We've got it in place, but we only have funding for 2 years. And that funding is through the American Rescue Plan funds, the federal funds that came to the state. So we're looking at ways that we can make sure that that funding is sustainable and we can keep that system in place ongoing. Another thing that we're working on is a lot of youth bills. As I mentioned, the youth are in crisis right now, and there's a lot of bills that are both can negatively affect mental health outcomes with them, as well as ones that can positively affect mental health outcomes. So we've been focusing on those, and we've also been focusing on a lot of Medicaid bills. Dr. Torrey also mentioned, talking about the access to care. And we know that for a lot of folks with mental health issues, they do have Medicaid as their payer. And so we're looking at ways to make sure that folks on Medicaid have the same access to mental health services that people with commercial payers have, and that everybody has access to those services.
That's wonderful. And thank you for mentioning the 988. We'll be sure for our viewers, we will link to that information at the bottom of this video, as well as the NAMI resources that are online. They have tremendous amount of resources on NAMI's website. So we'll be sure to link that at the bottom of this video. Now, Matthew, turning to you, what policies have been and still are a priority for Dartmouth Health to see signed into law? What existing policies are under threat and should be preserved, and why?
Sure. Thanks, Audra. Well, one of the first things I'd mention is Holly talked about Medicaid coverage, parity and equity. And I would say one of the things that's a priority for us is Medicaid expansion needs to be reauthorized in New Hampshire this year. It's coming to the conclusion of a 5-year cycle. So that's reauthorization of Medicaid expansion is clearly something that's high on our priority list in terms of providing coverage, not just for mental health challenges, but for the spectrum of healthcare needs of a large swath of the population. So that's certainly one. We saw how important it was during the pandemic to be able to deliver care virtually, so via telehealth. And both the state and federal governments, frankly, were quite responsive at the outset of the pandemic by requiring coverage for and reimbursement of telehealth in both video and audio formats. So, which was particularly important in a rural area where broadband coverage is not always reliable, audio only, that is. Congress recently extended many of the telehealth capabilities and for another 2 years. And so we want to make sure that we don't backslide on that front. I'd say another important component of remote care delivery was licensure flexibility for Dartmouth Health, which has roughly 40% of its patient population in the medical center from Vermont. We needed our providers who were located in Lebanon to be able to provide care to someone in their home in Norwich to be licensed or have their New Hampshire license recognized by the state of Vermont. Licensure is, of course, a state regulated issue. So we were really fortunate and worked quickly with Vermont agencies and the legislature to make sure that our providers could provide that care. And in the context of a workforce shortages, now it's important to have easy entree so available providers can provide care as soon as possible. So we'd like to retain that good progress with licensure. generally, I guess I'd echo some of the things that both Will and Holly mentioned, which is we'll continue to advocate for a comprehensive system of care continuum from crisis avoidance to institutional services to post-acute community options. And I would note that Holly had talked about the number of bills that have come in recently. And I would acknowledge that New Hampshire's made multiple attempts to create a comprehensive system. I think the issue is the price point, and now an exacerbated workforce challenge.
I think that was really interesting how you said the comprehensive system of care is really what we're working towards. And thank you for giving that behind the curtain look of what the work that you're doing at the state level, because I think not everyone really truly understands how much is involved that goes on the advocacy front. So thank you for sharing that. So on that same kind of line, Dr. Torrey, let me turn to you. So if you could prioritize one thing for our legislators in New Hampshire to change so that more people had access to mental health care, for that comprehensive care that Matthew talked about, what would it be and why?
Well, it's hard to boil down to one thing. I guess I would start by just saying that solving the mental health care crisis in New Hampshire is really everyone's responsibility. It's all of us working together. That's really the only way it's going to be done. And that means every citizen, because these issues can affect all of us and do affect all of us. So I think that when people work together, and I really highly value my relationships with people in the state, because I think there are tremendous dedicated people working hard there, as well as in the hospitals and the community settings. So I think that we all need to, the more energy we have drawing ourselves in parallel, the more we're going to get to happen. But if I had to choose one thing, I would say that the state really should invest heavily in our community mental health system. I think that that people really deserve to get care close to home, adults and children. They should have easy access to extremely high quality care in the community setting. So investing in outpatient care and supports actually reduces the need for inpatient care, because people will get their difficulties served quickly. But part of that investment, I just would really urge that everyone think of the community mental health system as well as the hospitals as being care providers, but also educational institutions, places where our young people can come to train, so that they think of them, we build it out as a training organization at the same time as a clinical care organization, because that way we will train more social workers, psychiatrists, psychologists, and psych APRNs. And when people come to New Hampshire to train, we want to be a magnet for people, because people tend to live where they train. And if we can pull people in, they're likely to contribute professionally here over the course of their lifetime. So providing outstanding care and outstanding clinical training really go hand in hand. But I would invest in both at the same time.
Yeah, I think that's a really great point. And you had shared earlier about how it truly affects everyone. And I think one of the statistics we've shared in previous Heads Up recording is, 1 in 5 are affected by mental health. And that's such a powerful number that it may not be you, but it might likely be someone that you love or care about. So being invested in being aware and understanding the impact is truly important. So Holly, now you spend your time advocating for some of these changes at New Hampshire State House. And sometimes this legislation is passed, and sometimes the legislation effort you're advocating for is voted down. So it's back to the drawing board. How can everyday people, as Will suggested, we all need to get involved and be aware. How can everyday people help NAMI and get policies passed that would really improve our state's mental health system?
It's actually pretty easy to get involved. And I did want to mention, though, before I get into that, with 988, one caveat that people do need to know is if you do not have a 603 area code for your phone, then you will not be connected to the folks here in New Hampshire. You will be connected to the folks at the crisis center of whatever state your area code corresponds to, such as I have a 207 area code. If I was to call 988, I would get Maine. I just want people to know that. We are working on that, trying to work on that at the federal level. But going back to how folks can get involved, on the NAMI website, there is a take action page, which has all of our testimony. It has the bills we're following, and it has links for how you can connect with the legislature to do remote testimony if you want, or just sign in on a bill. You can sign in opposition or in support of a bill from your home. You can write letters to the editor. You can also come to the State House and testify in person. And, if you're interested in wanting to know more about the mental health bills that are out there, we send out a public policy alert every single week. And all the bills that we do follow do impact folks with their mental illness or suicide. So there's lots of ways to get involved, whether that's even watching somebody's child so that they can go and testify. That's still being involved in the process. So even if, testifying or letting folks know your opinion isn't your cup of tea, there's other ways you can get involved. And you can connect with NAMI New Hampshire if you're interested in doing that.
Thank you for making it so easy for people to help and get involved and stay educated on what's going on. And for our viewers, we'll link to that Take Action site at the bottom of this video. So Matthew, let me turn to you. I want to ask you about, the workforce challenges that I think all three of you have kind of mentioned that exist, that it's not only in the mental health field, but throughout the, healthcare in general. This is a major reason why institutions have limited capacity to serve patients, and it's not something that can be solved, only through financial resources. So what are some ways the state or federal government can help alleviate the shortage of sorely needed providers?
Yeah, thanks for the question, Audra. Just before answering that, I wanted to acknowledge the work that Holly and NAMI does in the state for mental health, and to reiterate how accessible our legislature is, right? It's a 400 member House, 24 member Senate. You'll run into your representatives in the grocery store. You should advocate when you see them there, in addition to making your voice heard in Concord. So just know that it's a very accessible legislature. So workforce. Workforce was an issue before the pandemic, and it was certainly exacerbated during and as a result of it. I think people are aware of the challenges hospitals are facing, the high cost of travelers, folks leaving medicine, et cetera. I mean, Dartmouth Health has over 1,300 vacancies, last I checked. But it's also importantly not just an issue for hospitals. Both upstream and downstream challenges compound the issue for us, but we don't experience the pain ourselves in isolation. So, for example, long-term care facilities, nursing homes, et cetera, they've been severely impacted by workforce challenges. And so that reduces the number of beds available for hospitals to discharge folks who are no longer in need of acute care into, which further reduces the number of beds we have available for intake on the front end for those with emergent needs. We've had to decline receiving patients sometimes in the neighborhood of 300 a month due to capacity limitations, often resulting in patients being sent out of state to Connecticut or Massachusetts. This obviously has parallels to those with acute mental health issues, unable to get the care they need where they need it due to community and institutional capacity issues. In terms of what the government can do to help, I'd say the two pieces I discussed earlier, telehealth and ease of licensure, are crucial to the provision of care in the context of workforce shortages. And I imagine enhancing some of the existing incentives commonly used to attract people to the field, better pay, particularly for mental health providers, student loan help, et cetera, would be helpful. Will talked about training and how do we attract people to train here, because when they train here, they're likely to stay here. So I would say those are some of the things that I can think of that would be helpful to address some of the workforce challenges. Not an exhaustive or exclusive list, but a start.
Definitely a start. And that makes me think of our Workforce Readiness Institute that we have at Dartmouth Health. That's a really great opportunity that is being put together for paid apprenticeships, internship programs, paid training for medical providers. So we'll be sure to link to our Workforce Readiness Institute at the bottom of this video. So, before we wrap up, this has been a very robust conversation, but before we wrap up, what is one key takeaway that all of you want to provide for our viewers? And Dr. Torrey, I'll start with you.
Well, I think there's a lot we can do to improve the situation working together. And one key takeaway is that we certainly have a lot of room for improvement in building out a system where we can provide the workforce development that's available. We could be having a statewide or a twin state system of care that would make New England, Northern New England, a magnet for people who want to train as social workers, nurse practitioners, psychologists, and provide outstanding situations so that people will flock to our area to live and work. And I think that that could have a huge long-term positive impact on people living with psychiatric difficulties.
Mhm. Holly, what's your takeaway?
I think, as Dr. Torrey mentioned early on, that, this is the mental health crisis is something that everybody needs to get involved in. We need all hands on deck. And he mentioned every citizen. And I think it goes back to how easy it is to access our legislature, as Matt mentioned. And, most of their home phone numbers are on the website. You can pick up your phone, give them a call, invite them out for coffee. So just getting to know your legislators and getting involved in the process is really important, because we do need all hands on deck in order to solve this crisis.
Mhm. And Matthew, what's your final takeaway?
Well, I think I would borrow something that I've heard Dr. Torrey say in the past, I think, which is that the limited capacity to provide timely access to care is hard for all of us, right? It's hard for the patients and providers. And that's true across the healthcare spectrum, and particularly true, I think, for mental health challenges.
Thank you. And I think what I've learned from all three of you today, and it's such an important point, is that we can all take action and we can all do something, whatever it is, we can all do a little bit of something to help end the stigma and help bring this awareness to our legislators. And NAMI has great resources in order to get involved. So thank you for reminding us that we can all do our part. So Dr. Torrey, Holly, Matthew, thank you for joining me today.
Thanks.
Thanks so much.
So to view past Heads Up segments and access all additional resources and information, we'll have a link at the bottom of this video. Thank you, everyone. Stay healthy and stay safe. Take care.
Bye-bye.